Diarrhea and dysentery are health conditions that affect your digestive system. The symptoms of diarrhea and dysentery are quite similar and include stomach cramps, nausea and bloating. While the two do affect your intestines and waste disposal system, there is stark differences between them. In this video, I will talk about those differences along with some home remedies and suggestions on when to see a doctor. To begin with, it is important to understand what diarrhea and dysentery are. Diarrhea is a common health condition in which a person suffers from watery and loose stool. Dysentery, on the other hand, is an infection or inflammation of the intestine that can lead to the presence of blood in the watery stool. Dysentery is also referred to as bloody diarrhea. Knowing the causes of diarrhea and dysentery can help you tackle the root cause of the disease and make you healthy. Now, let's get into the causes of both diarrhea and dysentery. Diarrhea may be caused by various factors. Some include taking certain medications, food allergy, digestive tract issues, parasitic infections through food and water, trouble digesting certain things, irritable bowel syndrome, food that upsets the stomach, and radiation therapy. Contrary to diarrhea, dysentery is caused by viruses or bacteria rather than factors. If you consume food or drink anything that is contaminated, you can get dysentery. Bacteria that cause dysentery include the following: Shigella, Salmonella, Escherichia coli, and Campylobacter. Let's delve into the signs and symptoms of both diseases to help detect them early for timely treatment. When it comes to diarrhea, signs and symptoms include loose and runny stool, urgency to empty your bowels, frequently going to the toilet to clean your bowels, nausea and cramping or abdominal pain. For dysentery, symptoms are sudden urge to empty your bowels, bloody in stool, loose, runny stool, constantly going to the toilet to empty your bowels, pain in the stomach, vomiting, muscle cramps, and fever. You have to note that the symptoms of dysentery are quite similar to diarrhea, but dysentery are severe and are additionally accompanied by some other symptoms, mainly bloody stool. When it comes to prevention, whether one has diarrhea or dysentery, it is always the best to follow precautions to save yourself from the difficult symptoms and pain. Here are some preventative measures one can take to avoid diarrhea and dysentery. By drinking safe and hygienic water. Contaminated or uncleaned water can lead to diarrhea, and if it contains any of the dysentery-causing bacteria, then it can also arise further issues. You can prevent yourself by storing food properly. If you keep your food at the right places or temperature, it takes away the chances of bad bacteria and viruses to nil. Cooking food should be done and handled carefully to prevent diarrhea. You can get vaccinated. In many countries, the government also advises vaccination to prevent diarrhea. For instance, you can get the rotavirus vaccine, mainly for children to prevent rotavirus, which is one of the main cases of diarrhea. Talk to a doctor or professional healthcare expert to understand which vaccine is suitable for your health issues. Again, you can prevent yourself from diarrhea and dysentery by adopting good hygienic habits, drinking only bottled water when traveling and cooking your food thoroughly before consuming. At times, home remedies can also prove beneficial in treating these health issues. However, it should be noted that these home remedies should be used along with the doctor's advice and should be followed along with other medicines. For a healthy and stronger digestive system, follow these common and effective home remedies. 1. Drink a lot of water to stay active and fight diarrhea. You can also take oral solutions to stay hydrated. 2. Consume probiotics to create a healthy environment in the stomach and fight any bacteria. Some of the best food for probiotics are cottage cheese, dark chocolate, green olives, yogurt. 3. Avoid fried and greasy foods as it can further lead to diarrhea. You should also avoid alcohol and artificial chewing gums and soft drinks. 4. If you have discomfort in the rectal area, fill bathtub with lukewarm water and sit in it for a few minutes. Later, clean the part with a soft and clean towel and apply petroleum jelly or Vaseline. Note that in case you have dysentery, make sure you do not just rely on home remedies. If left untreated, it can lead to a severe health complication. Just visit the doctor and get proper treatment. No matter if you have diarrhea or dysentery, it is always the best to seek treatment from an expert. Even if you are using the home remedies, visiting the health facility must be a priority. You should contact the doctor when you experience a severe abdominal pain, have high fever, when you have a diarrhea that has lasted more than 2 to 3 days. Again, visit the health facility when you started noticing signs such as dry mouth, lightheadedness, and lastly, when you notice dark and strong-smelling urine, contact your doctor immediately. To wrap up, the major difference between diarrhea and dysentery is the change in their causes. You can prevent or even try to treat them at home with the best remedies. But whenever your condition becomes severe, you must visit the health facility or your doctor as soon as possible. Only the doctor can offer the best possible treatment with fast results. Thank you for watching. I hope you now know the difference and some home remedies for diarrhea and dysentery. Don't forget to like, comment, share and subscribe to this channel for more health-related information. Until next time, stay safe.